Hello, my name is Dr. Yi. I am a doctor at the local hospital.
Dr. Yi, please help me. I'm sick.
But wait, do you have health care?
In the wake of that highly charged debate over the failed effort to repeal and replace the Affordable Care Act, we have a broader question about your view on health care. Should health care in this country be considered a right that should be guaranteed for all Americans?
The general welfare clause is often the constitutional route when debating healthcare as a right or as a privilege. The question is, did the framers of the Constitution want to create 1. A general government of limited powers, or 2. A government of unlimited federal authority? What does this mean? Tax collected by the federal government must be done so for the benefit of the U.S. as a whole. In other words, tax collected must be done so for the general welfare, for the common good of the country. This, of course, must be done within the boundaries of powers delegated to the federal government within the scope of the Constitution.
Now that we have explored what the Constitution has stated, let's explore what has been done thus far in American history. First, let's explore key legislation associated with healthcare. Medicare and Medicaid were passed in 1965. Medicare is a federally funded program that mainly benefits individuals aged 65 years and older. Medicaid is a federally funded program that mostly benefits low-income individuals, families and children, pregnant women, and those with disabilities. Medicaid is broken down into 4 portions. Part A covers inpatient care, Part B covers outpatient care, Part C covers access to a plan from a private health insurance program approved by Medicare, and Part D covers prescription drug costs. The Patient Protection and Affordable Health Care Act, passed in 2010, requires citizens to have health care insurance or face a penalty. This is known as the individual mandate. This act also requires businesses with more than 50 employees to provide health insurance for their employees. Secondly, let's explore the role of bipartisanship and partisanship associated with healthcare. There's current deadlock in Congress as to amending ACA and implementing the new Republican healthcare bill. Bipartisanship is needed to move forward in this country and amend the current healthcare system. In 2017, the tax reform bill was passed. I quote, "Technically, the GOP tax bill doesn't repeal the individual mandate. It simply reduces the penalty for going uncovered to 0. But in practice, eliminating the penalty will have the same result as eliminating the individual mandate altogether." End quote. This bill was passed with a vote of 51 to 48, which is voting strictly along partisan lines. Next, let's explore the role of presidential leadership in healthcare. Obama played a key role in the passage of the Patient Protection and Affordable Health Care Act, basing much of his presidential campaign on the issue of healthcare. President Trump has also based some of his presidential campaign on the promise to repeal Obamacare. His first executive order, Executive Order 13765, set out procedures in anticipation of the repeal of Obamacare. Now let's talk about the role of federalism and state policy associated with healthcare. The expansion of Medicaid is one relevant example. Most states administer Medicaid through their own programs. For example, California's system is called Medi-Cal. States that wanted to expand Medicaid allowed individuals with incomes up to 133% of the poverty line to qualify. Congress's authority to enact healthcare legislation comes through the general welfare and interstate commerce clauses.
Next, let's discuss bureaucracy that deals with healthcare. There are 4 main bureaucratic organizations that deal with healthcare. The first is the Department of Health and Human Services. This department oversees 11 agencies like the Food and Drug Administration, the Center for Disease Control, and the National Institute of Health. Centers for Medicare and Medicaid Services is the 4th one. This federal agency is in charge of Medicare and works with states to provide Medicaid and the Children's Health Insurance Program. The Food and Drug Administration is the 3rd one. This federal agency provides standards and regulations to ensure that food and drugs are safe to consume. The 4th one is the Drug Enforcement Agency. The DEA is responsible for prohibiting the use of illegal drugs. One important party in the healthcare discussion are the interest groups. There are many private insurance companies such as Pfizer, United Healthcare, Anthem, Blue Cross Blue Shield, and Merck. While these private insurance companies don't have a seat in the Senate or in the House, they do possess the money to run ads that can heavily influence a politician's career. Other influential organizations include the American Medical Association and the American Association of Retired Persons. These organizations can also lobby Washington to achieve their own goals. The media also plays a role in healthcare. The Pew Research Center stated that healthcare takes up 3.6% of airtime with pharmaceutical commercials. The media has enabled and exposed consumers to the latest and best products. Public opinion may have been largely shaped by the media's coverage of politicians' promises of healthcare. According to NPR, 29% of pollsters don't want current healthcare reform to pass, while 26% wish to make major changes, 24% want to make minor changes, 8% want to pass it, and 13% don't know. The Supreme Court recently made an important ruling in the National Federation of Independent Businesses versus Sibelius. In this ruling, they stated that the Affordable Health Care Act was constitutional and upheld the mandate for Americans to have health insurance. Many countries have a single-payer healthcare system where all of its citizens are covered under that insurance. However, many in the United States are afraid that government inefficiency or lack of competition may lead to higher costs or a slower healthcare system. Because of this, the majority of healthcare reform has been directed at providing other options to go with the structure we have now. The Affordable Healthcare Act established a public option to go along with private insurance. The public option is provided by the government but is not a single-payer system. It is just another option that the consumer may choose while acquiring healthcare.
I'm Ann Smoot. I'm a registered nurse with hospice care through a company called Capital Caring. I think when you start issuing mandates, it's tough because people are individuals, and having one rule that covers everybody's situation I don't think is real feasible or possible. I think medicine is an individualized thing for individual people.
Some say that healthcare is a right, and that the General Welfare Clause supports the idea of healthcare as a right.
Does that make sense to anybody? Our job is to join the rest of the industrialized world and make sure that every man, woman, and child has healthcare as a right. No matter what your income is, when you get sick, you go to the doctor.
Some say that healthcare is a privilege, and that the General Welfare Clause does not support the idea of healthcare as a right.
I think it's a responsibility in this respect, in that we should have available and affordable health care to every American citizen, to every family member.
We recommend that states should be given the authority to decide whether or not an individual mandate is best for their constituents. In America, a large and diverse country, we believe that healthcare is a deeply personal issue and that every person and state should be considered individually. One solution does not fit all of America.